And when you phone 911, the dispatcher doesn't tell you that the ambulance is 45 minutes away. I work at Oxbow and I'm a CCA. I also worked EMS. Down there, there's 3 different services, Redverse, Cardiff, and Oxbow. And we cover probably a 100-kilometer radius. We're from Manitoba border, almost to Estevan, the United States border, and up. Redverse is pretty much a volunteer thing. They're only, like they phone when they're in operation, they're usually not.
I've noticed just in the last 5 years, say, the amount of drug usage in small communities like Weyburn and Estevan has gone up tenfold. It used to be just mental health issues. We had bipolars coming in, schizophrenics, etc. Now we get a lot of people that are a drug-induced psychosis, and they come in, they're coming off of methamphetamines and having all kinds of delusions and hallucinations, not because of a pre-existing medical condition, but because of the drug usage.
Cardiff's going to be out of service for most of this month. They're going to be out of service more than they are in it, which leaves 1 ambulance to cover the whole area.
We're a smaller facility than, say, in Regina. Regina is a fairly large psychiatric unit. We only have 10 rooms and 10 beds, but we kind of take all of southern Saskatchewan. And
we've argued and tried to get it out there, when a school bus doesn't run on a snow day, they put it on the radio and say they're not running. Why are they not telling the community that their ambulance service is not running that day? They need to know, because if somebody is in immediate danger, they need to have the option to drive themselves or wait the hour.
5 years ago, we didn't have as many patients. We seem to be almost full or over full and turning people away and having to send them to other units more often.
I filled in for a year in Cardiff, which is my hometown, and I did all 8 cardiacs that year. I was on every one of them. And 2 of them were people my age and my friends' moms, and they didn't make it. They were gone by the time we got there, right? And so that's rough, and then you're required to go back to work for the rest of your 8 hours, or you don't get a paycheck. There's no debriefing, there's no, you just carry on with your day. And then I myself had a heart attack. And then I was like, I'm done. I can't do this job anymore. It's just way too much, way too much.
The best part of the job is when you see somebody who struggles and then they get over it. They get through it. They come out clean. They come out on the other side.
We're all small, and so it's 24-hour shifts. We're required to work on the floor for 8 hours because that's how you get paid. And then you're on call for the rest of the 24 hours, you get $4 an hour. With this cut, I'm going to have to work more. So I go back on the casual, which means the people that are just starting out under me aren't going to get the shifts, which therein it really affects us, because if they can't go into different departments to stay within the health center, they go out and find other jobs. And then all of a sudden you have nobody to work.